So we're going to move from England to Scotland. And Stephen, delighted that you're going to be doing this, Stephen. So thanks very much indeed.
Thanks a lot. So I'm Steven Kerr. I'm a Senior Data Analyst at the University of Edinburgh, and this is a quick tour of the data that we have in Scotland. Next slide, please. So the sort of umbrella term for the project is EAVE II, so it's Early Pandemic Evaluation and Enhanced Surveillance of COVID-19. And there's a number of collaborators that we have there. So the data that we hold is pseudonymized and held on a secure server hosted by Public Health Scotland. Next slide. So this is the data sources that we have. So we have some GP data. So the GPs record age, sex, area of residence of their patients. We can also request read code extracts. So read codes are used by GPs in Scotland for encoding clinical information. So for example, you go to the GP and you have a headache, there'll be a code associated with headache, and that gets recorded by the GP. We don't have access to all of that, so we only get an extract, we only get part of that, and we get extracts that are sort of relevant to the research that we do. We have vaccination information, and that comes from the Truris Vaccine Management Tool, which is a web-based tool that allows clinicians to record vaccination information. So mainly the things we get are the type of vaccine. So it could be AstraZeneca, Moderna, Pfizer, and the date it was administered. We have testing data, so both PCR and lateral flow tests. From that, we can get the date of the specimen, the test result, and the S gene status. So the S gene is just a particular presence or absence of a particular genetic variation in the virus, and at various times it's been a very good proxy for which variant of the COVID virus you have. Next slide. We have access to hospitalization data that comes from the Scottish morbidity record and the rapid preliminary inpatient data. From that, we get the date of hospital admission, date of discharge, the main reasons for admission, and the date of ICU admission, intensive care, if they were admitted to intensive care. We have deaths from the national records in Scotland, so that would tell us the date of death and the main causes of death on the death certificate. We have virological sequencing, so that's given to us by the whole genome sequencing service at Public Health Scotland, and that tells us which variant of the virus, the COVID virus that you have, so Omicron or Delta and so on. Next slide. We have some serology data, and the main measurement we get from that is the levels of immunoglobulin G, which is the main type of antibody found in blood, and that sort of tells us how well your immune system is mounted defense against COVID-19. And we have prescription information from the Prescription Information Service, and also HEPMA, which is, well, you can read the acronym there, but it tells us the type, duration, and date of dispensation of different prescriptions. Next slide. And the final thing to say is that, so a lot of our research activity is now migrating to the National Safe Haven, which is separate from the Public Health Scotland server, which most of the work has taken place on up until now. So that is managed by Public Health Scotland, but it's hosted at EPCC at the University of Edinburgh. And EPCC is a high-performance cloud-based computing service, which contains most of the same data sets. And it's just, yeah, thank you.
Yeah, great. Thanks very much indeed, Stephen. Fantastic.